There are certain medications that actually can make migraines worse. Probably the most common class of medications that can make headaches worse would include SSRIs, which are very frequently used for depression and anxiety. These very frequently will worsen headache. There are other medicines that in some individuals will worsen headache as well. In addition to some medicines that do make headache worse, actually the use or the overuse of medications that are supposed to make headache better can actually make headache worse. We refer to this as either medication overuse headache or rebound headache, and what that is certain medicines, when they're used more than a certain number of times per week, and this can include things such as over-the-counter ibuprofen, Tylenol, Excedrin, to prescribed medicines such as the opiates or medicines containing butalbital such as Fioricet, and even some of the medications like the triptans, which would include Imitrex, also known as sumatriptan. All of these medications, when used more than a certain number of times per month, can actually make headaches more frequent and more debilitating. In most cases, it is okay to go ahead and discontinue the medication altogether. Oftentimes we look at weaning an individual off of the overused medication, and at the same time that we're weaning the individual off of that medication, we'd look at putting them on a known preventative medication that can reduce the burden of headache. And I always tell my patients it generally takes about 60 days to start noticing improvement after discontinuing a medication that has been overused, and frequently those patients will worsen temporarily prior to improving, and so it's very important to stick with it and look at the long-term goal of getting better.